African Americans and the health system. The complex history of African Americans has led to skewed perceptions that have left negative lingering effects in today's medical practices. Uncovering and understanding the true history of African Americans may unveil answers that can improve some of the health disparities in the African American community. The enslavement of African Americans led to a decrease in the African American population, as well as the health disparities within the community. Fertility was limited and kept under control. Disease and nutritional deficiencies were widespread in the community by the 17th century. Mortality was high among enslaved populations. The social construction at the time placed African Americans lower than any other demographic, so their health disparities were never attended to. If they were done so with very little attention. The Tuskegee-Syphilis case study was a project of the Public Health Service in conjunction with the Tuskegee Institute. Researchers asked the African American community for participants, and 600 men answered, coming forward with the perception that they were to receive free health care. 399 of the men had syphilis, while 201 did not. They were told they were going to be treated, but never were. The study was conducted without patients' full knowledge or consent of the research. These patients were never offered adequate treatment for the disease, even when their penicillin was known to cure it in 1947. The unethical practices that surrounded this case study continued to further widen the gap between African Americans and the medical field. Currently, one of the biggest health disparities plaguing the African American community is the major decline in birth rates among Black women. African American mothers are 4 times more likely to experience infant or maternal mortality than Caucasian mothers. This is due to the disregard of African women by the health field. Entrenched in medical biases that have their roots in enslavement, mothers are often ignored with regards to their health problems, even when they come forth to their personal physicians due to the skewed perception surrounding the health disparities of Black women. Having a more in-depth look into the history that surrounds African Americans gives us a broader and more complete understanding with regards to the health disparities in that community. Understanding the inherent biases in the medical profession that are erupted in racism can guide us to improve modern-day health care for not only the African American population, but for everyone.